Hey guys, welcome back to another video. I'm Pooja and today we're going to be identifying structures and pathologies on radiographs. Let's get started. So let's start out by checking out some of the normal anatomical structures you can spot on a panoramic x-ray. You'll typically see the condyles, the maxillary sinus, the hyoid bone, the zygomatic process, the coronoid process, the maxillary tuberosity, the incisive foramen, and the mental foramen. Now, something that often trips people up is this faint horizontal line that shows up just below the molar roots. It's one of the most commonly misread features, and no, it's not a fracture or a pathology, it's actually just a ghost image of the opposite side of the mandible. Panoramics aren't just great for spotting normal anatomy, they can also help us catch dental anomalies and pathologies. So let's take a look at more of those in detail. The first example is a Mesiodens, which is a type of supernumerary tooth that appears between the permanent maxillary central incisors, and on this radiograph you can see it clearly positioned right at the midline. Next, we can see pulp stones, which appear as small radiopaque spots within the pulp chamber or the root canals of the teeth, and these are calcified masses, and in most cases they don't cause any symptoms, they're asymptomatic, and they're usually just an incidental finding on the radiograph. A panoramic x-ray can also help us spot a mandibular fracture, and you'll usually see it as a clear break or a crack in the continuity of the bone in the image, and you can see it here on the right side of the patient's image. Another type of fracture we might see is a parasymphysis fracture, and this can show up on either a panoramic x-ray or a CBCT scan. And this type of fracture occurs between the canine teeth, and just to recap, a symphyseal fracture happens right along the midline of the mandible. A panoramic x-ray is also really helpful for spotting Eagle syndrome, and this happens when the styloid process becomes elongated or the stylohyoid ligament becomes calcified. In this image, we can see both styloid processes, and just take a look at how much longer the one on the patient's right side is compared to the left. And just a reminder, it still happens to me, right-sided structures show up on the left side of the radiograph. And patients with Eagle syndrome might experience pain when they're turning their head or they're moving their neck. A panoramic x-ray can also reveal signs of osteoarthritis like condylar erosion or flattening, but it's not the only imaging tool we rely on. For a better look at the articular disc, we turn to an MRI, which is a great tool for soft tissues since it can pick up on the subtle differences in water content and tissue structure. On the other hand, a CBCT gives us a detailed, high-resolution 3D view of hard tissues like bone, which make it ideal for closely examining the joint itself. Now let's take a look at a couple of lesions that might show up on a panoramic, and both of these will appear as radiolucent areas or dark spots on the image. So the first one is a traumatic bone cyst, and it's benign and often linked to some kind of previous trauma. And the second one is an odontogenic keratocyst, also known as a primordial cyst of Gorlin syndrome. So this one comes from the dental lamina, and it tends to be more aggressive and usually requires close follow-up. And learning these two terms is important for the exam, so remember an odontogenic keratocysts are associated with Gorlin syndrome. Another lesion we might come across is an odontoma, and this is a benign tumor that's made up of tooth-like structures, and on a radiograph it'll show up as a radio-opaque mass with irregular edges. You'll often see a cluster of small calcified structures that kind of look like teeth, and it's all surrounded by a radiolucent zone. Next, we have mandibular tori, and these are bony overgrowths that can develop on the inside of the lower jaw, and they're usually kind of tucked right under the tongue, and you can catch them on a panoramic, but they're best viewed with a CBCT. One of the most common findings we see on a radiograph is dental caries, and they typically become visible only after there's been about 30 to 40% mineral loss, so early lesions may not always be detected or show up clearly on x-rays. Next, we have attrition, which happens when enamel or dentin wears down from grinding, and it can also show up on a radiograph. In this case, you can see that the crowns of the lower molars are worn down and they appear kind of flat. Let's talk about periapical radiographs now and take a look at some of the normal structures. So when we look at a periapical of the maxillary incisors, we can often see a clear view of the nasal spine. And around the teeth, we might also spot the bone marrow, and if we look really closely, we might also notice nutrient channels running between the roots of the teeth on the x-ray. Dental radiographs are also very helpful when it comes to spotting dental anomalies. They can help us identify things like conjoined teeth and differentiate between fusion, gemination, and concrescence. So fusion happens when two adjacent teeth join together at the enamel dentin and sometimes even the pulp, and usually it leaves one fewer tooth in the arch unless there's a supernumerary tooth involved. Gemination, on the other hand, happens when a single tooth germ splits and it creates a bifid crown with a shared pulp canal, but the tooth count stays normal. And then there's concrescence, where two fully formed teeth join by the cementum alone with no change in the tooth count. And here's what the three aforementioned dental anomalies look like on x-rays, with fusion showing union of the adjacent teeth, gemination showing a single tooth germ splitting, and concrescence showing teeth joined by the cementum. Supernumerary teeth, or extra teeth, can also show up on an x-ray, and in the image on the left, we're looking at a specific type of supernumerary tooth called a Mesiodens, and we touched on it briefly earlier, and this typically appears between the two permanent maxillary central incisors. Another dental anomaly we can spot is a dens in dente, which kind of looks like a tooth inside another tooth, and that's because the enamel folds into the dentin. Pericoronitis is the swelling and the infection of the gum tissue around the wisdom tooth, and it can also show up on an x-ray. And it's important to remember that infections in the mandibular third molar region can sometimes drain into the submandibular lymph nodes. I've had pericoronitis before, and it's not a fun experience. You may also spot a foreign body in the radiograph, which can sometimes be hard to identify. It might show up as a purplish lesion or discoloration when you look inside the patient's mouth, and in this case, it could be an amalgam tattoo, which appears when tiny bits of dental amalgam get embedded in the mucosal tissue, and it's usually from a dental procedure or accidental fragments that got left behind. Now let's talk about resorption, and the first one we need to discuss is external resorption, and this is the loss of tooth structure that begins on the outer surface of the root and progresses inward. And on the x-ray on the left, there's external resorption of the distal root of tooth number 18 as a result of the impacted tooth number 17 pushing against it. Meanwhile, on the right-hand image, internal resorption occurs when the tooth structure is lost from inside of the root canal due to inflammation of the pulp tissue. And this can sometimes occur during whitening procedures when there's poor canal sealing during internal bleaching, which can lead to internal resorption. Our first sample question asks, which of the following dental anomalies is visible in the radiograph? Alright guys, take a second to pause the video and to answer the question. Okay, let's take a look. The correct answer here is D, and here we can see a supernumerary tooth between the maxillary incisors, which is characteristic of a Mesiodens. Our second sample question asks, what is the next step after your diagnoses? Alright guys, take a second to pause the video and to answer the question. Okay, let's take a look. The correct answer here is C, plan for surgical extraction. So a Mesiodens is often extracted if it causes crowding or misalignment of the teeth. It can delay the eruption of the permanent incisors. It can lead to an infection or a cyst formation. It can affect the appearance of the permanent central incisors, or it can interfere with orthodontic treatment. So for all of those reasons, removal or surgical extraction of the tooth helps prevent any further complications, and it improves dental alignment. Sample question 3 asks, what pathology can be seen in the following radiograph? Alright guys, take a second to pause the video and to answer the question. Okay, let's take a look. The correct answer here is A, odontoma. And an odontoma shows up as a radiopaque mass with irregular margins surrounded by a radiolucent zone, and an odontoma includes multiple small calcified structures that may resemble teeth. Our final practice question asks, which of the following best describes the bilateral horizontal line extending beneath the apices of the mandibular molar roots in the panoramic radiograph? Alright guys, take a second to pause and to try the question. Okay, let's take a look. The correct answer here is A, ghost image of the contralateral mandibular border. And this happens because panoramic imaging picks up the structures outside of the focus area and overlaps them onto the image. And it can show up as a faint horizontal line underneath the mandibular molars, and it can sometimes be mistaken for a fracture or any other issue. So be careful not to confuse it with the inferior alveolar canal, which appears as a well-defined dark band, or with a machine artifact, which usually shows up as a more consistent straight line on the image. As we come to an end, let's do a quick recap of what we went over in this video. The first point, radiographs may be used to identify normal structures and pathologies. And the second, different radiograph types can show the same structures. Alright guys, that's it for today's topic. Thanks for watching and I'll see you next time.